would you recommend sleeping pills?
There's a question in the chat box actually from someone asking that question. Well, I'm a psychologist, and my aim is to help people to sleep without needing medication. And also the NICE guidelines, as in the National Institute of Clinical Excellence for the NHS, they suggest that the first line of intervention for insomnia should be CBT-I, which is Cognitive Behavioural Therapy for Insomnia, which is the psychological intervention that I do, that should be done ahead of sleeping pills. Now, sleeping pills, modern day sleeping pills, so diazepam is more of just an anti-anxiety drug. It's not, and it will help you to sleep because you'll feel relaxed, but it's not actually a sleeping pill. So sleeping pills, the modern ones, are called the Z drugs, like Zopiclone, and they knock you out. But the trouble with sleeping pills is that you become tolerant to them extremely quickly. So, if I took a sleeping pill like Zopiclone every day for a week, and then I didn't take one on the last day, I'd have huge rebound insomnia, because my brain will have, in a short space of time, become dependent on the sleeping pill, and without it, I wouldn't be able to sleep at all, or I'd have huge problems with sleeping. And then you get into a situation as a user of sleeping pills that you think, well, I need the sleeping pills because look what happens when I stop taking them. I don't sleep at all. But actually it's the rebound effect of not having the pill. A bit like if you were a heavy smoker and you stop smoking, you get the nicotine withdrawal. But sleeping pills, they're not a long-term solution, is what I'm saying, because you get this tolerance very quickly to them, and then you get the rebound insomnia. But they can be helpful in the short term, just to get you over a crisis point. And a little bit like you said with the diazepam, just having a couple of tablets, it just gives you a night where you think, well, I had terrible 3 nights was awful, but I had this one night of good sleep, so I feel like I can cope again. I feel like I can face the world, and then that makes you more relaxed, so that then the pressure isn't on you having to sleep the next night, and then you're likely to sleep better. So there's a time and a place for sleeping pills. It's not a long-term solution, but they can be very helpful in the short term, especially if you're at a crisis point. I see a lot of clients who are really, really, I would say, at crisis point with their sleep.